Thank you everyone for joining. We'll get started now. If others join a little bit later, that's okay. We can have them join in progress. For those of you that are on the webinar for the first time, VIA Global Health has a very specific way we like to run these training sessions to be the most efficient. And you'll notice that everyone here is on mute, which means you cannot use your microphone. And we do that to allow our presenters to have the full floor. And then we open a question and answer section towards the end where you can ask any questions you may have about the product, how it works, any of the benefits as well. So there's two ways that you can ask questions, and you can ask questions at any time, but we won't answer them until the end. You can either do that by clicking on that question section, and you can type a question in and do that anonymously if you like. Or what you can do is click on that hand icon, which allows you to raise your hand, and when called upon, you can ask your question directly to the presenter through your audio. And with that, VIA Global Health is very proud to present to you Suellen Miller, who is the leading expert in the NASG technology and has been conducting studies on the garment for years now throughout the world. So this is someone that you can always learn from and ask any questions, and she will have all the information you could possibly want. If there's anything related to pricing, logistics, things like that, you can ask those to me directly or follow up with me by email. I'll have a slide at the end that introduces you to myself and how to contact me. So with that, I will introduce Suellen Miller.
So I'd like to say good morning, good afternoon, or good evening, wherever you are, of people who are viewing. And I'm really happy that you've joined us. And I'm especially happy that VIA Global Health is working with the manufacturer of the NASG LifeWrap brand, and that I'm able to show to you what we've been doing, how to use the garment, and answer any questions that you might have. So go ahead and just advance it a step. Okay, so what is it? Basically, it's a neoprene and Velcro lower body compression garment, and it applies counter pressure against the entire lower body. It does two really important things for women who are having hypovolemic shock due to excessive blood loss. It reverses shock, and it decreases further blood loss. And I think the best way to understand how easy it is to use and how rapidly it works is to view this video of the anti-shock garment being used in a real-life situation with a hemorrhaging woman in Nigeria.
The BP is 70 query. Then we apply the anti-shock garment. It's hard to supply the blood to all parts of the body.
Immediately you set this anti-shock garment, the veins will be visible. Then once you set the drip, you'll find there is BP, there is pulse. Is coming back.
At 1 p.m.,
the CPP is 90-60, which is a bit okay now.
Yes, sir. Before we couldn't get the vein. Well, we applied the anti-shock garment.
Most of our midwives are trained on how to use this anti-shock garment. The time that we didn't have this anti-shock garment, the woman will just go, will just die, because there is nothing we can do to help her. The only thing we can do is just to elevate the foot of the bed. Apart of that, there is nothing we can do.
The blood is her immediate need. They haven't got blood yet. We took her blood sample for the relation to go for blood cross-matching and grouping, but still yet you can see how many hours ago? No blood yet.
even if it takes a long time before the woman gets blood, that anti-shock garment also help a lot to keep the woman going.
Okay, so I hope that this was informative. I was obviously a very tragic, it could have been a very tragic moment. And what we found in many places around the world where there are long distances between facilities or from a home to a facility, and where blood transfusions are difficult to obtain, that the anti-shock garment will be able to sustain the woman, keep her alive, keep her stable during these long delays. And it's a very good first aid device for overcoming the delays for any woman who's having obstetric hemorrhage and who's going to be facing these delays, who needs blood, but the anti-shock garment will help put the blood in the organs where it's necessary. So that's the anti-shock garment, how it looks in segments. It's got these 4 leg segments, 3 leg segments, and then the 4th segment goes around the pelvis, and then the larger segment at the top is the similar stretchy material with the Velcro closing, but it also includes a ball that sits over the uterus and adds additional compression. Next slide. So how it works. I know that some of you are not medical people and others of you are, but the basic thing is that our bodies are designed to really defy gravity. And our circulatory system, even when we're standing up, doesn't mean that blood isn't getting back into our brains when it gets through the circulatory system. That system breaks down in shock when someone has lost a great deal of blood. And instead of going to the heart, lung, and brains, which are the organs that keep us alive, the blood goes out of that system and goes into the extremities where it's not really needed. In addition, with obstetric hemorrhage, blood is leaving the body from about the middle of the body. So next. So we have the patient in shock, and you see the thicker area of blood down at the lower extremities. When we apply the anti-shock garment to the woman's body, it displaces the blood that's in the lower part of the body and allows that blood to circulate to the heart, lung, and brains, keeping the woman alive and reversing shock. At the same time, it's putting pressure on the blood vessels under the compressed area, which will decrease the bleeding and sometimes actually stop the bleeding. And I want you all to note, it is not a tourniquet. A tourniquet is a device that actually stops almost all the blood. Blood is still going through the entire body. It's just decreased in the extremities where not so much blood is necessary. Next. So the NASG is actually unique in obstetric hemorrhage and hypovolemic shock. It's to be used with as many hemorrhage therapies as are necessary to stop the woman's bleeding. So that could be anything. It could be drugs, it could be massage, any vaginal procedures, even for surgery. It doesn't compete with these approaches, and it's not either or. It's not, do I use a uterotonic or do I put the NASG on? It's a matter of the situation and what's necessary. And also, some of the causes of uterine bleeding, we usually think of obstetric hemorrhage as postpartum hemorrhage, which is mainly due to uterine atony. But if you give a woman uterotonic drugs like oxytocin or Cytotec, and it doesn't work, it may not be uterine atony. And the anti-shock garment actually stops bleeding from all sources of obstetric hemorrhage. So that could be uterine rupture, lacerations, ectopics, anything that is happening in the pelvic area. It's the only technology that is available at low levels of the system or in transport that will reverse shock until the blood transfusion is necessary. And this is something that can also be used with the balloon tamponade or the condom balloon tamponade. If the woman is bleeding and she's bled enough that she's gone into shock, it's true that the internal tamponade may be able to stop the bleeding, but if the woman's already gone into shock, then she needs a blood transfusion, and the NASG will reverse the shock until she can get a blood transfusion. Next. We started doing our work with the NASG in 2002. It was a garment that had a first aid device that had been used in many countries, and then it stopped being used, and we sort of picked it up again, using it for obstetric hemorrhage in low resource settings. Now it's in use in over 33 countries, including developed countries, higher resource countries such as the US, Canada, the UK, in instances where women are far from services, rural midwives, for example. In the UK, it's being used widely among a network of Seventh-day Adventist hospitals. The Seventh-day Adventists not believing in blood transfusions or not being able to receive blood transfusions, and it's made a big difference there. Next slide. So I'm going to just sort of briefly cover the clinical trials for those of you who are interested in them. As I said, we started in 2002 and we've been continuing through 2016. We did these clinical trials because the WHO requires evidence that a particular device or drug really works. So we have published a number of these. And if you go to this website, the www.safemotherhood.ucsf.edu, and you go through the menu to the publications drop-down, and you'll get to a page where each title of the work we've done has been linked to a PDF. So you can, if you have access, you can access these articles. The next slide. So this is what our home page looks like. If you go to this Safe Motherhood program, and then you can see this little circle is on the publications page. Next slide. And then each of our publications, and it's many, many more than this little sample is showing you, but you can actually click on it and get the full PDF of whatever that article is. Next slide, please. So I'm going to summarize the clinical trials because we've done so many of them, and this reference is on the bottom of the page, and it's definitely on our publications page. The people other than ourselves, mainly from WHO, did what's called a meta-analysis or a combined analysis, and they put together all of our studies to look at overall what happened, and I think they had 2,590 women involved in these 5 studies that they looked at, and we reduced mortality by almost 60%, and this is an incredible finding, that something simple and low cost, easy to use, easy to train, could reduce death by almost 60%. In addition, it definitely reduces blood loss, reduces anemia, and the woman has much faster recovery from shock. So our evidence is very strong now, and we're all quite in awe of the fact that such a simple device could do so much to save women's lives. Next. So this again just shows our publications page. I'm sorry, our home page with the publications. Okay. And we have the NASG and the UBT are often used as examples of either or. And as I mentioned before, these can be used together. So there's now some interest in using the UBT and the NASG together in what is being called an NASG balloon sandwich. The filling of the sandwich is the uterus, and they're putting pressure between the inside and the outside. And on our publications page, we have 2 different articles that are looking at how these 2 devices work synergistically to enhance women's recovery. Next slide. Next slide. I'm going to just run through these next slides really quickly, show where we went in 2002 to what's happening now. The World Health Organization is recommending the non-pneumatic anti-shock garment to policy and program makers. They should review their guidelines and ensure that the NASG is included in hemorrhage management. They should review their training curricula and ensure that providers are trained, and they should buy the NASGs and procure them and to use them for low resource settings as needed. Next. In addition, the International Federation of Obstetrics and Gynecologists also have the non-pneumatic anti-shock garment on their guidelines, and those guidelines are on our publications website. Next. It took a while in India to be able to achieve acceptance of the NASG, but it's definitely there now. It's in the AICOG manual, and it's being included in many curriculums now. Next. Recently, the NASG was advised or recommended in the LANCET's Maternal Health Series, which was published in the end of 2016. Next. Now, the UN Committee on Life-Saving Commodities joined with Blue Fusion, who is one of the distributors of the NASG, or one of the manufacturers, the Clinton Health Access Initiative, and my organization, the University of California, San Francisco, signed an MOU to provide the NASG at lower costs to every mother, every child countries. And with this, we were able to develop a Blue Fusion LifeWrap product that is able to tolerate 144 wash and stretch and recovery cycles. Before, it was only 50. So we now have a greatly reduced unit price per time it's used, and we have improved durability. Next. So now we're going to see a slower step-by-step how to apply the NASG. You saw how rapidly the two midwives in the first video were able to put it on. I mean, I think it's 12 seconds or something. But now we'll see a step-by-step slow introduction, because this NASG can be applied by anyone who's been trained to use it. It doesn't require a healthcare professional. Anybody can apply this if they've seen this video or attended a training. Okay, go ahead.
You're bleeding too much. You're bleeding too much. We're going to save your life, Anna.
The NASG is a lightweight compression suit made of neoprene and Velcro with 6 segments that close around the ankle, calf, thigh, pelvis, and abdomen. The Velcro fastenings keep the garment on tightly. The abdominal segment, number 5, contains a small foam ball to apply pressure to the uterus. Anyone can be trained to apply the NASG. First, place the NASG under the woman. The top of the NASG should be at the level of her lowest rib, and the row of yellow dots should be along her spine. Starting at the ankles, close segment number 1 tightly around each ankle. Make sure it is tight enough so that you can snap it and hear a sharp sound. Next, close segment number 2. Try to leave the woman's knee free so she can bend it.
Are you okay, madam?
Apply segment number 3, the thigh segment, in the same way as 1 and 2. Apply segment number 4, the pelvic segment, all around the woman at the level of the pubic bone. Place segment number 5, with the pressure ball, directly over the umbilicus. Then close the NASG with segment number 6. Although 2 people can more rapidly close the leg segments, only 1 person should close the pelvic and abdominal segments.
So that's the simplicity of how easy it is to put it on, very much slowed down for the purposes of training. In addition, we have available job aids that are large poster size step-by-step photographs of instructions so that people in the workplace would be able to apply this, and anybody who had forgotten a step could see what they need to do to make sure that the anti-shock garment is being applied correctly. Next slide. So the anti-shock garment, the LifeWrap, is being used here for transport. So at the lowest level, at the primary healthcare level, the village and community level, this device can be put on and the woman can then be transported to a facility that can take care of the woman, a higher level facility or one that's capable of a blood transfusion or IV fluids or whatever is necessary for this woman. Because it's soft, the woman can be in any position. Here we show her getting into an ambulance, but here below we show her on a motorcycle ambulance. Next slide. And here you can see this man is lifting the woman in the anti-shock garment, putting her in the back seat of a car where she can lie on her side curled up. And in the worst of situations, when there's no other way, she could be hand carried on a stretcher, again, in the anti-shock garment for many hours without it causing harm to her, but keeping her alive. Next. That's at the lower level and for referral purposes. Once she gets to the higher level, there are many steps involved in the management, removal, and cleaning, but this is done by trained, skilled attendants who manage the woman. They give her whatever is normal at that facility for hemorrhage and shock management. So this does not interfere at all with the normal care, and this is very important. Because providers are trained to do an emergency procedure. So they have their repertoire of skills that they're used to using. And we're interrupting this just a little bit because now the woman is in the anti-shock garment. So much of the training that we do, and in the video we include vaginal procedures, how to give blood, conduct surgeries, all with the anti-shock garment on. We remove this only at higher level facilities under medical supervision. And the removal starts again at the ankles, but is done very slowly in between each opening of the segment. You wait 15 minutes, and this allows the body circulatory system to become stable before you move on to the other segment. Okay, next. And we have a formula on our website for disinfecting and laundering the NASG. The only thing I think that's important to know is that the bleach solution used to disinfect this garment is very, very low. It's 0.01%. So this is very dilute. But we have this Excel spreadsheet on our website which enables a person to put in whatever type of bleach they're using and estimate just how much bleach they'll need to attain the 0.01% solution. All right, I'll let Brian take over now, but I'm happy to answer whatever questions that you have.
Thank you very much, Suellen. So as I mentioned earlier, if anyone has questions, there are two ways to do it. You can either raise your hand with that hand icon, which allows you to ask a question directly to Suellen or myself, or you can type a question into that question section, which you can do anonymously if you don't want people to know who is asked. But those are the two easiest ways. You can also follow up with me after the conversation and after the webinar to send along any questions you may have. But I'll go through just the first couple questions that have been posed here. The first one, Suellen, is asking how long can a woman be kept in the garment?
Well, what we have now is a lot of data, and we have seen where in places where there's a really long delay in getting blood, or for rare blood types, women have been kept in this garment for up to 3 days, 72 hours, with, again, no side effects or harm coming to her from wearing the garment. In general, the use is usually about 6 to 8 hours before it's removed.
Okay. And the next question is, can it be used to prevent shock from trauma?
Yes. Actually, this device was developed as an anti-trauma garment and was used in many emergency vehicles and for first responders. Its function is greatest in the pelvic area. So while it can be used for lower limb accidents or a machete wound to the leg, it's not as effective and efficient as it is for the pelvic organs, which is the uterus, the tubes, things that are in this area underneath ball compression, because about 75% of the effect is due to that abdominal segment.
Okay. Next question up is, can we use for pelvic injuries apart from PPH?
Yes. Again, as I said, all obstetric hemorrhage, and it's used in France for the abdominal aorta for any kind of problem in the pelvis. So yes, the answer is yes.
Okay. And then there was a question about washing. You had mentioned the solution, the bleach solution. Is there a specific way in which it should be washed? Machine that should be used? Any kind of process?
Yes, the first step would be to wash off under running water, if possible, with a scrub brush any big clots or tissue or anything that's large. Then to be put into this 0.01% bleach solution and immersing it completely in that. And that often requires placing a brick or a rock or something heavy on top, because it might float to the top otherwise. And then that's 10 minutes disinfection, and then washed either by hand or washed in a washing machine. It should never be dried in a drying machine. It should be hung up to dry.
Okay. And then after 144 washes, is it recommended that you would then replace the NASG with a new one?
Yes. What sometimes happens is that people use too much bleach, and you can start to see that the bleach is very, very, very damaging in the long term, that things will start to get frayed and loose, and then you can feel it that it doesn't create as much pressure, and that's at the point at which it should be replaced.
Okay. And I guess related to that pressure, sizing is the question we have. If you could, I guess, answer specifically about the Indian subcontinent, but then overall questions about sizing of what size woman should have the small versus the large, and whether it's height or weight.
Okay, the anti-shock garment is quite adjustable, and one thing that we didn't show but is in the video, the training video, and in our training curriculum, is for shorter women you can fold up the bottom number 1 segment so that it is inside of the garment, and then you start at the ankles with segment number 2. So that's a way of being sure that if you have a shorter woman, you can still use the same garment that you use on a taller woman. We developed this larger size of the anti-shock garment for large women or average size women. So women 5'5" and above can easily use this large, or we could call it a regular size. We did develop a smaller size for women who are less than 5 feet tall and less than 100 pounds. And we did that because even though the length is adjustable and you can pretty much make it fit anyone of any height, the larger garment did not apply adequate compression on smaller women. So in many places they only use the small size, in some places they only use the large size, and in some places they get both because they have different sized women in different areas.
Okay, so the recommendation if you were making an order would be to have a mix of the 2 sizes, just to have basically all size women covered within.
Well, I think any place where there's women who weigh less than 100 pounds, and we can convert that to kilograms if necessary, if that's the norm for the women there, there's no sense in having a large garment because it won't work, and it might confuse people to try to put this larger garment. It won't provide enough compression.
Okay. It looks like that's all of the questions that we have typed in so far. But again, for anyone that has any follow-up questions or would like to know more information about pricing and quote, the reason we're not providing that now is we just have quite a few different people on the line, so it's more relevant to have those conversations directly with you, so we can provide the correct price and shipping information that's accurate for your country.
Great.
So with that, I'd like to thank Suellen Miller for taking the time with us, and Obviously, your wealth of knowledge is always appreciated and beneficial for everyone to hear from. So thank you very much.
Thanks so much.
And also for the participants, all of the information about the anti-shock garment can be found on the VIA Global Health website. So if you go to that link at the bottom of the page, the non-pneumatic anti-shock garment link on VIA Global Health, all of the clinical trials and studies that Suellen referenced are on our page as well if you want to find additional information. But we also have additional information about specifications, sizing information, ordering information. Everything is there as easy as possible for you. So if you have questions, again, please reach out to me by email directly, and I'd be happy to answer them for you. So with that, again, thank you very much to Suellen, and thank you to everyone on the line. I hope it was informative, and please follow up with any questions. Thank you very much.